Hello everyone, I'm Dr. Francisco, specialist nephrologist and transplant immunologist working at Francisco Clinic Medical Center in Singapore. Welcome to the Diabetes Health and Prevention video series. Today is time for part 10 on ambulatory glucose profile. So, I hope you enjoy it. These talks are part of our efforts of health promotion, focusing on diabetes prevention and early detection. As mentioned before, we have two health enhancement and weight management programs, ARIS and JANUS, so you can become a healthier version of your previous self. If you are interested, call this number or visit our website in www.franciscokidneycenter.com. This video is produced to increase awareness on patients and on the general population on newer options for glucose control, potentially for a better care of the diabetes. This is not a workshop to learn how to read the ambulatory glucose profile, nor for professionals, nor for patients. Although someone asked me why not to do a workshop for professionals in the future, I'm considering that option. Flash continuous ambulatory glucose monitoring is dynamic. Contrary to self-blood glucose monitoring, lab fasting glucose, and HbA1c, which are just snapshots. What are the characteristics of the ambulatory glucose profile? It is a summary of continuous glucose readings throughout the day and night for up to 14 days. It is unmanipulated, standardized, and is very visual. This is an example of an ambulatory glucose profile. You can see here the target range, for example, from 4 to 10. These plots indicate the following. This is the medium line, which is like sort of the average of your glucose readings. These shadows indicate the spread of your glucose readings. The dark blue shadow indicates that 50% of the glucose readings falls in this range. The light blue shadow, that 80% of your glucose readings fall in this range. Sometimes the maximum and minimum values during the day are also depicted. This is another example. The median line ideally should be within range, should be as flat as possible, indicating glucose stability throughout the day. Remember, this is a given day from midnight to midnight. The blue shadows should be also as thin as possible, indicating not so much variability of the readings from one day to another, because that means if it's very thick, that one day will be very high, one day maybe a little bit low, etc. Another example, this is a patient that is diabetic. You can see the medium line is out of range. It's also not very stable. I mean, there is a lot of fluctuations throughout the day. It is a little bit thick, indicating this glucose variability, and the variability has been associated with problems. Also, the hyperglycemia is obviously indicated in the top area, and hypoglycemia in the lower area. And in here, this indicates that this patient is at risk of hypoglycemia, or is suffering from hypoglycemia at this time of the day. So some intervention is to be done to try to change this. This is a normal ambulatory glucose profile. These are all the plots throughout those 14 days, lumped and summarized together in these plot and shadows. As you can see, the median line is very flat, so very stable. The glucose readings throughout the day. The shadows are not very thick, so there's not much variability. So it's a normal ambulatory glucose profile. But also, the ambulatory glucose profile can give you an estimation of the HbA1c. If you were to measure this patient's HbA1c, it will be around this number, 5%. This is a patient probably trending into the pre-diabetic stage. You can see it's a little bit thick. There is a lot of points of hyperglycemia. The HbA1c is higher, almost 6%. This is a diabetic patient. You see all the plots through all those days. Also, there is a lot of variability. Every day is indicated by one color. When you lump them together, you create this summary plot and lines and shadows. There's a little bit of variation, but a little bit on instability, but mainly is out of range, is on the hyperglycemic side. All this obviously indicate hyperglycemia in this patient, but also there is some hypoglycemia going on in the middle of the night. So also some intervention needs to happen. For example, if this patient were to be taking insulin at night, probably the dose needs to be modified. Another example, in this case you see, is very unstable. You know, in here it's very high sugar, but it drops dramatically, but it's still on the hyperglycemic side. A lot of variability, but also there is hyperglycemia going on in the morning. So some modification needs to be done for this patient. This example illustrates a lot of benefits of getting an ambulatory glucose profile over the snapshots, like fasting glucose and HbA1c. But let's just tell you through. This case was presented in one workshop I did. If I recollect well the history, it seems to be this patient had with diabetes, was on insulin, but had many episodes of hypoglycemia, as you can see. But indeed, the line is above the range, so the patient is highly hyperglycemic, but also going on with hypoglycemia. So after creating this profile, the doctor focused first on the hypoglycemia because it's a very dangerous one, reduce the insulin, and then the hypoglycemia disappeared. Also some lifestyle manipulations. If you were to measure the HbA1c in this patient and after that intervention, it will be probably around the same. But the situation in the patient is totally different. At this moment, he had a lot of risk of hypoglycemia, and here not, because the focus was mainly to reduce hypoglycemia. But the HbA1c might be misleading. Then the next step was to improve the lifestyle further, to give some oral medications to bring down the sugar, and then the patient, if I recall well the story, and then now the blood looked almost normal, and very stable, not much variability, and within range. So it's a stepwise process. But let me tell you, so if the HbA1c were taken, this patient will be a high HbA1c, correct? If the fasting glucose would have been taken in this patient, it will be also a high fasting glucose. So potentially the initial response from the physician could have been to increase the insulin. If this is the profile of the patient, by increasing insulin, just having that limited information could have worsened the hypoglycemia of this patient. You can take more accurate decisions if you have more information, more accurate readings, the whole sugar profile, the whole glucose profile. This is another example, is taken online. It was a heart transplant patient on sort of equivalent to mixed insulin. He was injecting the insulin in the morning but was not taking breakfast, so that's why this hypoglycemia. But they were still hyperglycemic. So your decisions will be very difficult to take if only you will have a fasting glucose, because then you will tackle this but not the hyperglycemia. When you have all the profile, not only identify this, you know where are the correct time points to administer the insulin. For example, in this case, what happened is the patient decided not to take breakfast, so the insulin was stopped and not injected in the morning anymore, but it was changed from mixed to a basal insulin. So the patient have insulin all the time in the body, and then during meals just injecting rapid insulin, pre-meal insulin, to tackle these hyperglycemic points, but nothing to be injected during breakfast because there is no meal. You can only achieve this knowing the whole profile. Let me just summarize what is the clinical utility of ambulatory glucose profile in the next slides. It detects fasting, pre-meal, meal, post-meal, bedtime, and overnight high blood glucose, but also low blood glucose. and detecting this dangerous hypoglycemia. Also uncovers the glucose variability and instability, as mentioned. Also, what I mentioned in the previous video, allows real-time feedback to patients on the effects on diet, lifestyle, exercise, medications, and triggers on them changes in their diet, lifestyle, or pharmacological interventions by their doctors. Also can be used for diagnosis of prediabetes and to aid in the diagnosis of diabetes when one of those tests are positive and maybe is in the limbo, or you need to identify what are the main points of high sugar during the day. So what are the benefits of ambulatory glucose profile? You can give more accurate diet, so doctors can give you more accurate diet recommendations or medication advice, can induce in yourself behavioral changes and better lifestyle. But some studies also have reported better time on target, so meaning less episodes of high or blood sugar, better HbA1c, either if you are taking insulin or not, and better quality of life. So I hope this talk was useful. Please stay tuned for this YouTube channel. Share these videos. Might be useful for you, may be useful for your friends or family. Talk about these weight management programs. I put myself into these weight management programs because I put on weight when I have a football injury. I have already lost almost 5 kilograms. I'm even below the weight pre-injury because I really want to avoid that I could develop in the future pre-diabetes or diabetes. So it's like an investment on my own health. So the next talk will be on diabetes treatment. So take care. Bye bye.